Today's June 17th. This is Doc. Doc is a 28-year-old paint gelding who has had a large injury when he was younger with broken ribs in a horse trader accident. And as he's aging, he's probably got some Cushing's going on. He's got a bit of muscle deterioration throughout his back. But he's been quite sore. His owner suspects that he's probably starting to fuse in his spine a bit. So we're just trying to give him some relief from pain and go from there. This is his second appointment with me. Doc is showing a lot of pain in his upper neck today. He is quite responsive and sore throat, the back of his neck, or his ear, back down his neck, and throughout his jaw and his left side. Was able to do a lot of pressure. He was very sore during it, but it has settled down now. He's had a little break from that, and he's not as responsive, so hopefully that loosens up. It has, this area has taken on fluid in the past, so we're hoping that he doesn't swell after such an intense massage. I went through both sides of his neck. The other side of his neck was better, but this side was all tense and tight and sore. So hopefully the other side has been compensating a bit. Oh, he bites. But he seems to be a little bit more relaxed now. He's kind of hard in there, but I think it's partly his age and his weight. As I went through, his scapulas on both sides were quite tight, and he responded negatively to them. I allowed him to graze, and actually, but by allowing his head to go down, I was able to get really deep in there and had really nice release. The left was worse, and I think all of the left side is reacting to this sore spot on his splenius, and he's just really sore there. So it's worse on this side than the other, but both scapula did release quite nicely. As I went up through his withers, he didn't act like he was sore, but he sure did enjoy it. He really relaxed and was quite happy. It just kind of put him back in that relaxed state that I needed him to stay in. So when he got a little bit uptight with the soreness, I just kept going back to the withers and kind of making friends again. His barrel, everything there felt good. All through his pecs felt good. Gelding scar was extremely responsive, especially on the left. Very sore, but he did relax. I actually went back a second time to the gelding scar, and that did help a lot, I think. His lumbar felt pretty good on his left. The right was really sore, and he responded with a lot of spasming throughout that lumbar. So he was actually quite patient with me. And again, I do the lumbar, go back to the withers for a bit, do the lumbar again. His back was a bit sore too, so this side I really worked on quietly, but I was able to get really deep. With this, I also was able to do a lot of lifting of his tail and giving him that stretch with his tail. Last time I massaged him, he couldn't lift his tail at all, and he was having trouble urinating and everything because that tail, he just had no flex in it. But this is helping the tail. So his tail, he's actually got it lifted away from his body. He wasn't able to do that a week ago at all. So this has really made great progress. His lumbosacral joint felt really, really good. His sacroiliac joint felt really, really solid. Hip joints felt really, really good. His hind end feels nice and quite relaxed, and no pain throughout his hind end, which was great. He had extremely good front and back leg stretching, which was fantastic. I mean, he is 28, so he's not as limber as most horses are, but for his age, I was really impressed. So he did really well that way. When I came back, when we were finished, I gave him another really good head massage. His jaw and his head are quite responsive to pain right now. He's quite headachy, so we just did some more, and he's still responding well to that. So the jaw was quite tight, and now it feels much better. I think that's something that really needs to be addressed is the pain in the neck and the pain throughout his ear. We'll keep on that for sure, and just kind of play it by ear week by week as he is older. So he's a very good boy. Carrot stretches are a big hit. His teeth aren't very good, so I cut the carrots quite skinny so he can actually work on them, and he's pretty happy about that because big carrots don't work in his little teeth problems. But in general, Doc is just an absolute gentleman and sweetheart, and I'm really happy that I'm able to help him out and make him feel better. Thank you.